As seen on Toronto Wildlife Centre's previous episode,
we learned about this coyote and his condition because a member of public by the name of Marge gave us a call because she'd been seeing this coyote on her property. We went and set up our trail cam, which is just like a game camera. We use it to help us determine if these animals are coming. We did get a great photo of this coyote and how mangy he was, and we knew right away that he needed some help. We were able to successfully trap him, which means he'll be with us for a little while. Once he has successfully gone through his whole mange treatment, he'll move outside, acclimate to these colder temperatures, and then we will release him back where he was found.
A few weeks of treatment later, the rescue team are happy to head out to see the coyote again.
We're at our east location today to get the coyote. He was cleared last week. His mange is fully treated. He is furred. He might not be like fully furred and like super fuzzy like you're seeing in coyote, but he's enough fur that he can deal with the temperatures. And it is quite stressful being in care, so he's better off going back into the wild to finish growing his fur. It's also like mating season still, so we want to give him that option to go out there and find a girlfriend. So today he gets to go home. So now that we caught the coyote, we're going to start heading back to where he was originally found at Marge's house. He just needed to get a little darker because these are nocturnal animals, so we do want to release him under the cover of darkness. But we'll start heading west to get him back home. Being able to successfully catch these guys and know that you're literally saving their lives is a huge deal for us. It's quite emotional, putting all this time and effort into it, knowing that this is kind of the coyote's only chance of help was for us to be successful.
Well, you did a good job, a very good job.
Back at TWC, the veterinary team prepares for surgery on a red-tailed hawk who suffered a tear in part of his throat, called the crop.
Surgeries are pretty common here. They're a little seasonal in their variation. So in the winters, we do a lot of frostbite for minor toe amputations or minor tail tip amputations. And then during baby season or migration season, we do a lot of minor wound repair. So our biggest things are just kind of these minor surgeries that are pretty fast and straightforward, but occasionally we'll also do orthopedic surgeries to try to fix broken bones and more extensive wound repairs like this crop tear.
So a lot of our surgeries that we perform here are mainly to try and help that patient recover quickly, to not have to endure a long duration of pain. Sometimes it is for their survival. So for example, that crop, there's no way that bird would have survived had we not intervened.
This hawk came in yesterday with a ruptured crop. A crop is just a outpouching or a wider, more able to dilate section of the esophagus that most birds or many birds have. They use it to help store food because their stomach volumes are pretty small, and they usually want to consume a decent enough meal and then get off the ground and get away from predators, and then just work on slowly feeding that into the stomach so that they can digest it. Usually when injuries like this happen, they're from some sort of trauma. It often happens right after a meal because the crop gets distended and full of food, and it's kind of like popping a bigger water balloon.
It's very possible that he had his big meal, was sitting around, and we got hit by a car. So likely it was traumatized by an impact and caused the crop to tear. So as a technician, my role during surgeries really are to watch that patient, mainly in charge of the anesthesia and monitoring all the vitals of that patient and adjusting anything I need to adjust to make sure that patient is stable while Dr. Cameron does what he needs to do to close that wound.
Basically, all we're doing is going to go in there, clean it up. We're going to take off any little bits of dead tissue that we can see, and then we're going to just put it all together with stitches and hope it holds.
Do we have a hairdryer?
Well, one of the things that you want to make sure is that you're preventing infection and bacterial contamination. So I want to flush all the bacteria that were in the juices from the esophagus out of the wound. So I used a lot of saline to flush all the bacteria out. So I want to try to dry off his feathers because they're really difficult to dry with a towel. And it also helps maintain their heat, and it's easier to regulate the temperatures so that I'm not burning his skin with it, and I'm also not cooling him down when he's under anesthesia.
the surgery was successful. We were able to close it. The tissue looked quite viable.
He should make a full recovery. He's been healing very well. I would say that the sutures and the surgery is already fully healed. So now we're just kind of waiting on him to regain some muscle mass, because once you keep them for recovery, sometimes they lose a little bit of their conditioning and need to exercise to build their muscle back up. So that's where he is right now, and he should be checked sometime this week in order to schedule his release.
He's got great coverage. That's great. See his eyes are changing?
Yeah.
The half brown.
Yes. Oh.
It's really neat how it starts down there and goes up.
Yeah.
Because the older red tails have the solid brown eyes. The juvies have the light and they darken as they get older.
So I guess I operate to save these wildlife because I find wildlife really interesting and fascinating. There's a lot of very interesting things that we can learn from them. And I feel like we, as a species, kind of owe them to try to reduce our impact on them. And this is one way that I'm able to do so.
They don't have owners that can vouch for them. They are out there getting injured most of the time due to us, due to infrastructure or habitat lost. So to be able to help those animals that have no voice, that have no one to take care of them, who are suffering, and to be able to help them go back into the wild and do what they need to do and be what they need to be, that is probably the most rewarding thing about going through surgery and having a successful outcome.
Today's the day that we are going to be releasing the red tail that had the injury to its crop. The surgery went well. He's doing great. He's now been cleared for release, so we're just going to go grab him and take him back to where he was found.
If you like our videos, please subscribe to our channel and make sure you hit the bell to be notified when we share new content. We would also love if you shared this video with a friend.